of students, highly impacted students, and other students who have benefited from one-to-one services. So this is not completely brand new about bringing students back into the school. And we will go to the next slide.
All right, I believe the student day is my portion. We do have our schedule ready for our student day for in-person learning. And our arrivals, our door will open, it's at 9:10 and our day begins at 9:15. Your campus will be giving you more information about drop off and pick up if you're going to be driving your children or walking the children. And then our bus department, our transportation department will be talking about bus routes and how you can access buses if that's something that you are interested in. We will be in the classrooms, as we mentioned. We have our desks already starting to be put in 6-foot distance from each other. The classrooms are being worked on currently by both the teachers and other staff to help make sure that we have safety in mind in our classrooms, including things like hand sanitizer, et cetera, to be able to make sure that the kids are safe and healthy. We will continue those protocols of safety and health throughout the day with hand washing frequently, hand sanitizer, things like that to keep the kids moving throughout the day because we know that they are little and that that's going to be essential. Our outdoor snack will be around 10:45. That'll be kind of a combined recess and snack time. We've already gotten all of our buildings outfitted with specific spots where the children can actually sit and have their snack. They can still socialize at a 6-foot distance, but they'll be outdoor so they can take their mask off and have their snack and still be able to chat with each other. We will be monitoring to make sure that they're sitting at an approximate, at the 6-foot distance and keeping good distance away from each other while still trying to have that social time and talking and interacting. With the snack time, we really want to encourage, as we mentioned in one of our videos, that the snack be something that they can get themselves opened. And the more hands that we have in the middle of all of that transaction, the less safe it is. So if a student has the ability to open it themselves and take the snack out themselves and eat it themselves, that would be a great thing. We will have a way for them to put trash away effectively as well. Then we'll continue with our rest of our morning learning. Our dismissal from campus will be approximately 12:30. Our buses will also transport the children home at that time. At that time, prior to our dismissal, there will be a SAC lunch available for students who request it, and that will be done with a lunch count in the morning. So as you are making your plan to go to school the night before, the morning of, just make sure that your child knows what that lunch, if they do need a SAC lunch to be brought back from school to home, that will be something that has to be requested specifically. And the children will get that and they'll be with the child as they go home so they can have lunch at home. And we encourage that after they have lunch at home, there's a little stretch break, a little physical playtime, maybe some Go Noodle or something fun to get their bodies moving, because then we're going to be at 1:20. We're going to have what we call a flexible remote instructional block. And that's going to be based on each campus and what the team of teachers feel is appropriate for their student learning. So that's something that we want to definitely get you to take a look at what your teachers have planned for you in that time. That's something that will be built for your specific class and your specific student group. Then we'll, as normal, have kind of our asynchronous student learning time. And during that time, as many of you have noticed, we've had some student support sessions. Those are staffed by paraprofessionals. And while the schedule may be a little bit different in terms of right now, there's some schools that may have that student work time going beyond 3 or 3:15 or 3:30. There could be some adjustments in that student work time, especially as we have our paraprofessionals joining us earlier in the morning so that we can have a great arrival to make sure that we are checking attestations. One thing I forgot to mention at that 9:10 time, the attestation is a huge, huge part of this. Your child's attestation needs to be done before they can actually be allowed out of the car or or on the bus for that matter. There'll be more information on that. So that attestation is the way to start your child's day the very best way.
So this is Mr. Hoffman again. Some of this will be fleshed out a little bit more in the slides to come. And again, we will entertain all the questions at the end. We just want to make sure there's only about 6 or 7 slides that we go through all our slides tonight, and then we are welcoming all your questions.
Thank you. Hello, I'm Amy Batliner-Gillette. I'm the principal at Northwood, and I'm going to talk a little bit about the health and safety protocols that we've planned and will have in place when your children return to the school building for in-person instruction. The recommendations that we've gotten from our partners in public health ask us to take a layered approach to virus mitigation. So that means it's not just one thing we do, it's several things that we do, and those things work in tandem to provide that risk mitigation for virus spread. So first, as Jill referred to earlier, we have the daily health attestation by all who will come to campus. So that's inclusive of all of our staff members and all of the students that arrive on campus. For those in-person learners who've already been visiting our buildings to receive instruction, they have been working with the health attestations already. And more information specifically will be forthcoming as to exactly how to complete those attestations. We do ask, as Jill referred to earlier, that those are completed prior to leaving home and bringing the kids to campus. We have some systems so that we'll be able to kind of check and see who has completed the attestation. If there is any kind of failure of the attestation, then that student or staff member won't be allowed to come onto campus that day, and that's for everyone's safety. And then we have some protocols and next steps to do to address whatever it is that was the issue in that attestation. We will have timeframes by which we will ask you to complete the health attestations, and that is to ensure that we can get that information in a timely manner so that we can be responsive to the kiddos that we need to pick up, the kiddos who are arriving by car, those who might be walking with family members, so that we are aware of all of the health and wellness status of all of our learners. Similarly, we are following the same process for our staff members as they come into the buildings in the mornings. Next up is masks. Masks will be worn at all times by all staff and students in the building. The notable exception that you heard of was when they take their masks off in order to actively be eating their snack or having a drink of water, that sort of thing. And within that layered approach means that when they're doing that, we're making sure we're still maintaining that 6 foot of distance. Again, there are posters already up around all of our buildings and accessible online as to what kind of masks are acceptable face coverings, but we will also have masks, more information about masks that are shared with you in a written form as we get closer to when we come back into the building with our kindergartners. Social distancing, right now our guidance is that 6 foot social distancing to keep ourselves apart from one another as another way to keep ourselves safe. That to that end, we have measured out and adjusted what our classrooms look like in terms of where the desks and chairs are. We have markers within our hallways to help remind each other of what 6 foot actually looks like. We have also made some adjustments depending on the campus in terms of the restrooms to ensure that there is space within those environments as well to make sure that we're at that 6 foot distance. Frequent hand washing. This is a big thing for all of us. We want to be able to wash our hands ourselves and to encourage and teach our kiddos to wash their hands with some frequency. And we certainly want to pay attention to the recommendations of when we really should make sure we're washing our hands. Things like before we put our masks on and before we take our masks off, before we eat or drink anything. If we sneeze or have to blow our nose, then we want to wash our hands after that as well. Bathroom use, obviously. So we'll have, each of our teachers will be thinking through about the ways that they can support that in the classroom. As parents, we hope you will partner with us and have already been teaching your little ones how to wash their hands effectively. We will also have available hand sanitizer. As you know, it's not always possible to wash your hands with soap and water. So we will also have a hand sanitizer as recommended by public health available for those other times. We want to minimize cross-contamination, which means that unlike what we have typically done in kindergarten, which is to put all our materials in the center of the table and learn how to share, we're going to keep our materials separate. So each child will have a bin or cubby or container of some sort where their learning materials for use at the school building are all contained and designed for them to use and only for that particular child to use. When we flex between learning materials, perhaps we've worked for a while with Unifix cubes and now we need to move into tile counters, we have a process by which we will pull those out, use the materials and the Virex and the different sanitation techniques that we have so that they can then be rotated or used by other students. We'll also follow protocols for things like books. So kids will have a collection of books that they will use for a period of time, and then we'll be able to swap those out safely through that cross-contamination process. In terms of the buildings and the facilities themselves, our custodial staff has already been hard at work regularly cleaning, disinfecting, and sanitizing our buildings. They have great routines in place already, and they've got great systems for making sure they're tracking, you know, what are the high touch surfaces, what needs to be cleaned regularly throughout the school day while people are in the buildings, and then what are part of the actual routines that they go through every evening. At this point in time, for example, our custodial staff goes through the building a couple of times a day and wipes down all those high touch handles on the doors to make sure that those are getting regular attention. So there's a lot of processes that are already in place that will certainly continue to make sure that those surfaces get cleaned regularly. Finally, we have maximum airflow in the buildings. They have basically turned up the pressure on our HVAC systems and our air handling systems to circulate and bring in a lot of outside air. And that's part of the mitigation to just make sure that there's not kind of pockets of air sitting there. We want to keep that air flowing, and that's a great way to refresh the air that's in the buildings on a regular basis. What that does mean is that on the days that's a little colder outside, it's also a little colder inside because the airflow is so significant that we can't necessarily heat that air up as quickly as we might have been able to do in the past. So we'll talk to a little bit more about how we're going to handle that as we move forward.
Okay. My name is Patrick Rock. I'm the Director of Transportation. We are excited about children coming back to school. Our drivers love to transport the kids. Wanted to talk a little bit about some of the information that will be available to you in the next few days. If you look at the transportation website, there is a link on the side that says e-link. You can go in there and you can type in your address information after Friday this week, and you'll be able to pull up where your child's bus stop is and the approximate time that the bus will show up. Everything in our buses this year is designed for COVID safety as well as your student safety in general transportation. So what that means for us is every student who gets on board the bus must have filled out a health attestation form. We are requesting that you do that early in the morning, by 7:30 would be great. But prior to dropping or bringing your child to the bus stop, every child that comes to a bus stop must have a supervising adult at the stop with them. And this is for the reason if we look down our list and we feel like there's somebody there that hasn't filled out a health attestation, we'll actually have thermometers on board, but that adult will actually take the temperature and fill out the attestation form for them. We're discouraging this because one of the biggest safety measures we have in transportation is limiting the time a child spends on a bus. And so the closer we can get to limiting that time to 15 minutes, the better off everybody is. And so the more you have prepared yourself in advance by going on to Skyward and filling out the attestation for your child, the better off all of our riders are going to be. When the child gets to a bus stop, we encourage any parents that are there to help encourage them to be 6 feet apart at the stop. And it might be a good part to even keep the child in the car. If you're going to stay with your child, keep them in the car until you see the bus pulling up. And so when we come on board, the first student that loads will be sent to the back of the bus. The child must be wearing a mask at the time, and they will load to the back of the bus first, and we'll just move them up. There will be one child per bench seat. So we will look about having 26 passengers on our bus. That's about roughly 6 feet apart between each one. We will require that they wear the mask the whole time they're on the bus. And we will have our ventilation pumped up too, which in a bus is its windows are really down some. So as we move, it gets a lot of outside air. There's going to be, chances are there's going to be a lot of traffic at the first few days of dropping off. So I would encourage you to ride the bus, because the more students we can put on the bus, the less the traffic will be on our major roads. OSPI has actually said encouraging people to take alternative methods of transportation, encouraging people to walk or to bike to school versus driving to school. I'd also encourage you, if you have children in the system for a while, to go onto your family Skyward account and make sure all your updated contact information is there. Because if for some reason there's a child without a health attestation filled out and there's nobody around to give the information, we're going to need to have information to be able to contact those parents. We cannot transport students on a bus without the health attestation. We're excited and we're looking forward to this.
Thank you. Thank you, Patrick. Lunches.
All right, thanks, Patrick, and thanks to all of transportation. I know this has been a big lift getting ready for rolling out our transportation plans. So hi, everybody, I'm Heidi Christensen. I'm the principal at Lake Ridge Elementary, and I want to take just a moment to introduce Jill Kelly. She talked to you on one of our first slides. She is actually our new associate principal here at Lake Ridge and with West Mercer. So
Thank
with
you,
that,
Heidi.
yeah.
I forgot, so thank you.
All right, so with that, I'm going to talk to you a little bit about lunch for our kindergarten students when we return to in-person learning. First of all, these will be boxed or bagged lunches that each student will order every morning from their individual teachers. Currently, there is no charge for these lunches, and really the process is pretty simple and intuitive. So again, students order their lunch from their teacher in the morning. The teacher submits a pretty standard traditional lunch count to the office, and then the bagged or boxed lunches will be delivered to the classroom before the students go home for the day. Then at the end of the day, students that ordered a lunch will be given the lunch they ordered to take home with them. So lunches will not be eaten here at school, or I just want to remind all students not to eat their lunches on the bus. I know they get hungry and want to sneak a little snack here and there, but food on the bus is never a good idea, and especially not now. So they'll need to eat their lunch when they get home. And of course, you may choose to provide your own lunch at home and not order the school lunch. Also, the menus for these school lunch, for these on-site lunches, are different than our current district-wide grab and go lunch menu that our remote learners, again, district-wide, can pre-order through our district's food service website, and then they go and they pick them up at the high school or the middle school. This is a different menu for our kindergarten school lunches, and we will make that menu available to families Friday evenings before the upcoming school week. But again, students will just be coming in and ordering from their teachers, and I believe there will be only one choice for lunch each day. One more time, there's just currently no charge for these lunches, and your child's teacher will be able to walk you through the process and advise you if you have any questions. So that's it, the shortest slide of the night, I think. Take it away, Carol.
Hello, everyone. I'm Carol Best. I'm the principal at West Mercer Elementary, and I'm here to talk a little bit about the things that you want to be thinking about to prepare your child for in-person school. First, I know you've heard it a number of times, but we're going to say it again. We need you to complete that daily health attestation. This is key to keeping everyone safe. We also ask that we ask that you really take those health attestations to heart. And if your child has any worrisome symptoms, or you've been near someone that has been diagnosed with COVID, that you really keep your child home. It will allow us to keep our schools open for in-person learning if we all work together and are careful about who our family is around, and be honest about the health of our families. So we ask that you make a plan or create a routine for completing this task. We ask that you complete the task early in the morning, not midnight or anything, but early enough that we can run reports and check to see who has completed it and who can be welcomed into the school or the bus. So we ask that you have that completed by 7:30, 8, 8:30, really as soon as you can before heading out for school. You do want to have a backup plan to access the attestation on your phone. We will be using Skyward. So there's a Skyward app that you can get on your phone that will make it easier for you to do. As we've mentioned before, we are hoping that you're helping your child practice wearing a mask and making sure that the mask that they have really does fit them comfortably and securely, and that if they've had extended time to practice wearing that mask, it'll make it easier at school when they're really asked to wear the mask all day. We have videos that have been and will be provided to students and to parents on hand hygiene, encouraging 6-foot distance, and how to wear a mask. So if you haven't seen those yet from your teachers, you will be shortly.
Okay, thank you very much, Carol. Our next slide is what to bring to in-person school. And this may vary just a little bit from school to school. As we approach our first day, you will get a lot more information both from the principals of your child's school as well as your child's teacher with some more specifics. But generally, as you heard both our transportation director and Ms. Batliner-Gillette state, that we are circulating the air both in the buses and in the schools. So as it gets colder outside, it's always a great idea to send your child with a coat or sweatshirt or layers of warmth. They can always take a layer off if they're getting too hot. And because our airflow will be increased, we will have open windows on buses, and they will still have recess. And as the weather stays sort of on the warm side, we'll be eating our snacks outside. Please send healthy, easy to eat snacks. Your child's teacher again will notify you if there are allergies in your child's classroom and probably provide you with a list of preferred snacks and other arrangements. I know that some teachers or schools asked if it's possible the generous donations from parents get sent in the snacks, and then the students share those donations. Be sure a student, if you do send your child with his or her own snack, that they can open the snack without assistance, excuse me. And as I just stated, no foods that are known to have allergies. We are allowing students to bring water bottles unless you hear differently from your child's teacher. And what not to bring in person. You do not have to send any school supplies back. We will have a second set at school. You can keep the remote learning kits at home at this time. And also you can keep the school iPad or your own iPad, whatever you might be using, at home, because your child will be returning or leaving school at 12:30, and there is the asynchronous times or synchronous remote learning in the afternoon, depending on the school, and they will need that iPad. Finally, it is my understanding that most schools, there may be one or two schools, we're asking that your child leave the backpacks at home. And again, if it's different for your child's school, you will be notified by your child's teacher. And that is what not to bring. I would also add that it is probably wise to send a few masks with your child. You can probably put them in a baggie and we can keep them in the classroom. If your child needs an extra mask and they don't have one, we do have lots of extra masks at school, and they are one-time masks. We will dispose of them after your child is finished wearing it. Okay, here's the time when we certainly want to answer the questions you may be entertaining, and we will refer them to the appropriate person who is best able to answer. So I'm going to let Carol, who's been monitoring our chat room, take it away from here.
Okay, So we do have a number of questions about the Red Remote all year classes. A question about when will those Red Remote all year classes begin? Is it too late to enroll in a Red Remote all year class? And will the Red Remote all year class stay on track with what's happening in person?
Well, I can start and then others can add to it. I believe that we had asked parents to send their preference in. It was noon today. And so we have moved forward with the responses for those who provided them. I believe the start date is 1 week from this Monday, which is the 26th of October. You will be receiving information in the next day or so about who the Red Remote teacher will be, what school the Red Remote program is affiliated with, and other pertinent information concerning that class. The question was whether also there was, whether they would be consistent in the curriculum and with the pacing. And yes, I would say everyone is pretty close in where they are throughout kindergarten, as we are all looking at the same essential core standards. Teams plan together. Sometimes they collaborate between schools. So yes, they should be very close in where they are with their current lessons. Did I miss a part of that at all, Carol?
There was a question about, is it too late to register now for Red Remote?
Well, I would say we are moving forward with those who stated their interest. We are keeping a waiting list for those who still might be interested. We will look at that waiting list, but I think we have started making plans for notifying those people who replied that they definitely wanted remote for the rest of the year.
There are some, there's a number of questions about the metrics that we're using and how are we going to decide when it's safe for students to return and when we need to pull back to Red Remote again. We have a question about, is the start date still October 22nd? So I know we can answer that. And a question about, will we consider delaying until at least February, like some other districts have announced?
So I don't know if someone from central office wants to take that question.
I can start off with the, this is Fred Rono, Assistant Superintendent of Learning Services. I can definitely talk a little bit about once we do bring the students back, our goal is to try our very best to not return the students back to Red Remote and then back to in-person and back to Red Remote. We're going to work very hard that when we bring the students back, that we're going to be able to keep them in school, continue to exercise all of those mitigating measures to keep the students and staff healthy and learning in the school. And those who are Red Remote for the year certainly want their safety as well. So we'll be monitoring all of that. But I think part of that question is really, what can parents expect from that? Donna or Tony, do you want to talk about some of the numbers and what we're watching each and every day as we put together our plans?
I can address that. In the communication that our families received today, there are some links that I would strongly recommend you take a look at. One of them links to what is called the decision tree, which was built in collaboration with Department of Health and OSPI and the governor's office. And the decision tree certainly does talk about the cases per 100,000 over the 14-day period, but it also talks about other considerations that we need to be looking at. So we do have weekly and sometimes more conversations with our public health Seattle King County. And the other pieces that we're constantly monitoring and looking at are what's the trend in increasing cases and also hospitalization, which actually right now are in what's called the green, according to the Department of Health and Public Health King County. We also look at the test positivity rate. That is a metric that we pay attention to as well. And then any other health and education risks and benefits to children and their families. Every district certainly can also look at the rates and the test positivity. There is a chart on King County Public Health that shows almost by cities and neighborhoods as to what the counts are. Mercer Island is in the good to go range in all of that, including testing, well above the county rate, as well as positivity and number of cases. We do look at that number. We don't completely ignore it, but we do also have to consider that about 2/3 of our employees come from off the island to work on the island. So we do have to pay attention to that and follow the guidance from King County. The director of that has been very clear with school districts that it is a regional count that we are looking at, as are other districts in the region. So those are the three main pieces that we look at, but we also have to look at staff availability. We have concerns with staff members who aren't available for in-person, and so we have to account for that as well.
Okay, we have some additional questions focused on what will happen. What protocols or processes do we have already organized for a student that needs to stay home because they are quarantined or they had a possible exposure? And the question is also, what is the time frame that students need to stay out, or do they need to have a negative test to come back?
Maybe we take that question in two parts. Ms. Best, maybe the nurses can answer the kind of that contact tracing piece and those components that I know Betsy and Eric and their team have been working on. And then maybe one of the principals you want to take the, if a student is out, then what do we do about their learning? Would that make the most sense on that, Carol?
Sounds good, yes.
Okay, Eric or Betsy?
Yeah, so if a student becomes ill either in school or outside of school, we will be asking that they do stay home. If you get a COVID test and it comes back positive, your student will need to stay home for 10 days and at least 24 hours until their fever breaks. Meaning if they have a fever for 9 days and it breaks on that 9th day, they can come back truly on that 10th day. But if they have a fever for, say they had a fever for 11 days, they would need to come back after it's free for 24 hours. If you do not get a COVID test, we are asking that you quarantine your student for 14 days from onset of symptoms until the end of that 14-day period. Did that answer the question?
And then I can also add, I'm Erin Battersby. I work sort of in the central office. I do HR and compliance and a number of other things. I've also put and answered in one of the questions a guidance document that sort of is an if-then, if the exposure of this, then what. So that may be helpful for parents if they wanted to look at that.
And then if we do have a positive test, we will certainly go through a contact tracing protocol. Our nurses have set up a comprehensive protocol sheet in conjunction with King County Seattle Department of Health. They will likely be a player in that to help with the contact tracing, and then we will be doing the notifications. Something that's a little different than perhaps what we experienced last spring before the schools were actually closed and then moved online, was when a positive test was coming up at a school, that school was completely shutting down. In this case, that's not the automatic recommendation by King County Department of Health. It's really using a lot of different factors, including that contact tracing, that will help make those determinations. So it could be a class, or it might be a cohort, or a small group, but it may not necessarily mean shutting down the whole district or even a whole school. So we will be working closely with our partners in public health, as well as the experts and our nurses who have done a great job putting together the backbone of really what that contact tracing is going to look like to keep all students and staff safe.
And then,
Want to add one more thing. I'm Betsy. I'm one of the nurses at Northwood Elementary. And I just want to say to the parents, I mean, I am so anxious to get these students back. But the days of sending your child to school and saying, I'm just going to give you a little Tylenol now and give me a call if you don't feel better, those days are over. And filling out that health attestation actually requires that you lay eyes on your student and talk to them. And I know that sounds crazy, but I was a mother of 4 kids in an elementary school once. And sometimes I left for work before I saw them. Never laid eyes on them because their dad got them off. And I was thinking about that, thinking, you know, I know how busy you all are, and it's going to be really tempting just to check that attestation because they were fine at 8 o'clock last night. But you do have to see them because they're going to come to school and tell me, I guarantee you, well, I didn't feel sick until this morning when I ate my Cheerios, because they tell me these kind of things and they're going to keep telling me these kind of things. So, and one other thing about putting extra layers on them, please put their names on them, because they got their cute little new sweater and they got they're going to say it's not theirs, and they're going to take it off when they get hot. And we're going to have our lost and found piled up again. So put their name on their clothes, truthfully fill out their health attestation, and don't give them Tylenol and send them to school. That's all I ask.
thanks, Betsy. I'll talk a bit about what about the missed work. Just as we have traditionally done, if a child is at home, and if a child is really feeling quite ill, we would certainly not expect them to be engaging in the day-to-day work of school. But as we typically do, teachers will collect any of the in-person learning tasks or activities that could be sent home or picked up by parents and make those available. And additionally, given the design of our day, there will be a remote flexible learning time in the afternoon, as well as a continuation of the asynchronous learning that can be accessed through Seesaw. That's one of the reasons we want to leave the iPads at home. So your children will be able to access that if they're staying home due to the guidelines that Eric and Betsy explained. But they also are well enough to engage in learning. They'll have access to all of that as well. And the other thing that I wanted to just let you know is that part of the thinking about leaving the iPads at home is both to ensure that they have access to that, but also because our teachers are committed to making sure that in-person time is a low screen experience, so that they have the screen time at home and the in-person interaction while they're here at school.
All right, we do have a few questions specific to students who are currently attending in-person appointments and have IEPs, and will there be changes in their service once in-person begins?
I can help answer some of that from a learning services perspective. Dr. Sue-Ann Booby and Hannah Bolivar, Beth DeGrace, who are our three-pronged directors of special services. They will be communicating out to families. First and foremost, if you have a child who is already receiving some services in person, that schedule will definitely be changing, because as they come back to school with their peers, they will have some changes to their schedule. Your case manager or IEP team may convene, or the case manager will be notifying you of what changes you might expect as we're beginning to bring students back. If you have children who are first grade through adult transition and even early childhood preschool, given the fact that we are reopening our schools gradually and slowly, we will also be making some alterations to their schedules. And it's really built around consistency and providing more services for students. Again, those will all be communicated out by the case managers and the special education department. Communication will start as early as the beginning of next week, and then we'll talk about a gradual roll beginning later next week, on into the following week, and then on into November. So there will be alterations, but you'll be getting messaging from that. And then Patrick Rock, who's on the call as well tonight from Director of Transportation, his team will also be communicating with you as families for that. So we can expect some alterations because we're going to be moving staff around to make sure that we are working with our kindergartners and providing them the maximum support, as well as those students who are already receiving in-person services and services in an asynchronous manner.
Okay, there were a couple of kind of detailed questions asking about, can we confirm that the older grades read remote will stay the same? If you have multiple students, can the lunch be picked up? Can the kindergartner bring the lunch home for everyone? And what is the time for recess and snack?
So I can respond to the lunch question. Unfortunately, the capacity to be able to manage the lunch delivery to kindergartners, as well as the 2 lunch pickup locations that are currently functioning for all of our students, doesn't allow for that kind of coordination of sibling lunches. So they really are going to have to be 2 separate processes. We will work with food services to place the kindergarten specific orders that will be delivered directly to the schools. And then for families who want to order lunches for their learners who are remaining in remote at home, they will go through the same process that has been in place since the start of the school year, which is to place an order online and pick up that ordered lunch at one of the food service locations.
As to the, there's a part of that question about, I believe it was a 5th grade, or in this case, it'd be grades 2 through 5. We just met, when I say we, Amy and I just met with or I guess all of us met with our Learning Forward team the other night to continue to work on the Orange model as it pertains to our 2nd through 5th graders, to see how we can start and bringing small groups of our students back, what that might look like, because again, that is our goal, to meet the needs both socially, emotionally, academically of all of our learners. And so as we develop those plans, we will communicate that out to families also, but we are currently working on that plan too. If there are specific instances of concern about a student, please start that conversation with your child's teacher, because we definitely want to hear those concerns and see if we can address them somehow.
But really at this time, the current red remote schedule will stay the same for our 1st through 5th grade students.
Carol, can I just add one more thing onto the lunch question? These are the regulations are USDA regulations, and they're very strict on the no cost lunches. So that's why we have to be very careful on where lunches are picked up. If you do have siblings that will be picking up a lunch at one of the other 2 locations, you can order your kindergartner's lunch through that same process and pick it up there. But it's only 1 lunch per child. So that's, the food service director will have to be very careful on how that gets regulated. But if you have to make a trip up to the high school or the middle school, you can include your kindergartner's lunch order on that particular order, and then they won't be ordering it in the classroom.
And then I think there was one final portion of that question, which was about what time will the snack and recess occur. The schedule that we've published has it, I believe, starting at 10:45. That may give or take 10 to 15 minutes, depending on the school site, because what we have to work with there is supervisory staff and ensuring that we've got the right people in the right places to supervise students. So that may vary slightly by school, but it's roughly that time of day. So you can kind of think about, when your child had breakfast, when their snack will happen, and when they'll be able to have lunch.
So there, another 2-part question. Someone asked about masks and how we're going to train students, or if we're going to monitor that students are wearing the mask correctly. And then a few attendees have asked about the social distancing and how firm that 6-foot rule is. If their child is injured, for example, will we maintain the 6-foot rule? Or if their child needs some help, will we maintain that 6-foot rule?
I can take that question on maintaining the 6 feet rule if a child gets hurt. We do have the proper PPE available that if we have to, if a child's hurt, we're just not going to stay the 6 feet away. I promise. We're going to go to that child and take care of them. If you think of the mitigating, it's that you don't want to spend 10 to 15 minutes in close contact. But it's just like if a patient was in a hospital and you have the proper PPE on, you're protected. And we're healthy. Your student is coming to school healthy. And if they fall on the playground, I'm not going to stand 6 feet back and say, no, dear, I'm not going to touch it. We're going to go to that student. They're going to come up into the health room. They're going to get the care that they receive. If they come to the health room and they have a fever, then it's different. We will isolate them in a special, we have our conference room ready, and we can keep an eye on them. And then of course we'll be calling parents. So the 6 foot rule will be ignored, but we're not going to, we're always going to render assistance to our students. So we will go spend as least time as we need to do the job properly.
And I would just, sorry, Betsy.
Go ahead, Amy.
I would just add that in general, in moving about the school or being in classrooms, we have set the desks to be 6 foot apart, and we have, we will be, setting some expectations for our children, but we also need to recommend or recognize that they are children. And when your kids come to school, they're still going to be kindergarten children. And so one of the things that we know from public health is that guideline, as Betsy says, is for, the majority of your time, but we recognize that they'll be walking past each other. They're kindergartners. They're going to touch each other. They're going to, congregate, and then we'll need to remind them. So we recognize that this is going to be a teaching and learning experience, and that we will adhere to that guideline as much as we are able. But as Betsy said, it's more about that layering and making sure that we don't spend so much time in close proximity. But we also have the other layers, such as the air circulation, the PPE, all of the other factors that we're working on. In terms of teaching our kids and working on helping them make sure they wear their masks appropriately, yes, we've got some videos. I think Carol referred to those earlier that are already out there. Our nurses and some of our students have helped us make some of those along with some of our staff. And you can help us out in advance of that by also supporting your child's learning in terms of wearing the mask up over the mouth and the nose, and making sure that you've got masks that don't have large gaps. The language that our nurses have used with us that we will use with our little learners is when that mask slipped down, we just pop that right back up over the nose, please. And so we've got a lot of training in place with our staff to help remind our learners to follow these guidelines as best as possible. But we also know they're kindergarten kids. And so we're going to do all the teaching and learning we can while keeping them as safe as we possibly can.
And Amy, I would just add, in terms of the 6 feet ideal, we have a series of a dot system, sort of follow the dot system in all the schools. So we will help the students remember how to line up by standing on a dot that is 6 feet away from the next dot next to it. Also, in terms of using the restrooms, I know I can speak for Island Park, and I believe all the schools have a dot system where you don't advance to the next dot if someone's standing on the dot, and that way it'll be an orderly process by which students enter and exit and use the restrooms.
And with respect to masks, it should be certainly made fully transparent that just like in the public, the CDC or Department of Health have listed certain criteria for people who don't have to wear a mask, children under 2 or students or people with certain perhaps health conditions. So we do have some students in our school district who wearing a mask is not something that they are able to do. We work with all of those families. It's not a reason to exclude them from school. It's a reason to find accommodations to help them still participate in a very safe manner. So certainly want to be transparent about that. And we'll have students who are going to test the boundaries. I can think of one of my 3 children who would be that boundary tester, to be honest, if he was still in kindergarten, although he's in 4th grade and he still tests boundaries. But they'll take their mask off, and we're going to have to reinforce that. And a student may have a sticker chart And the sticker chart is for every 20 minutes that they keep their mask on, they get a sticker, just like we use with other behavior modifications where a student who can't keep their hands to themselves, we use sticker charts, we use all kinds of reinforcement. And I think masks are going to be the same. What I have heard from our colleagues in the Peninsula School District and in Eatonville and some of the others who have opened up and have kindergartners coming is kids are doing a great job. There are going to be one-offs, and it might be your child. It doesn't mean they can't come to school. We're going to work with them and make sure that we make it successful for everyone. I think all of us working together, we can make this work.
Okay, I'm going to cluster a few questions together here as well. It looks like one of our attendees didn't get a chance to read the communication that was sent out this afternoon, so they're wondering when exactly is the start to kindergarten. And then other attendees are asking about older grades, and does this push back the start for first grade and second and fifth grade, and what sort of guidance we have on that.
I will take the, since this relates to today's communication. Yes, we have extended that timeline out for a 2-week period to give us 2 weeks to see how the metrics, if they stay consistent, particularly the numbers that are in the range that we want them to be in, the testing positivity and the hospitalization, what the trend is. So that will push it to November 4th. The asynchronous days would be November 2nd and 3rd. And then all things going well, our kindergartners would be in person on November 4th. As to our small groups in the other grades, we are continuing to work and to segregate out who those students would be and how we would serve them, certainly in 2nd through 5th, but also in 6th through 12. Our 6th through 12 leadership teams and learning forward teams there are working through logistics of students who fit in those categories who need to be in school. We already do have students there, but we know now we're starting to see students who are struggling. We're getting some data on that. And so working with those families to provide scaffolding and interventions, which might involve some in-person for those groups as well. All of it is contingent on the movement within the decision tree. We don't want to, we understand the whiplash, and every district is having to consider putting out a timeline and having to adjust it. And it's an agonizing decision to have to make, but we want to closely analyze the data and closely make sure that we are able to bring people safely in. Kindergarten will continue to be first, with first grade following, because we have made those classes in a space where they can fit. And but at that same time, we are working through logistics for small groups for our 2nd through 5th, and then ultimately our 6th through 12 as well.
Okay, we have what I think is a very quick question. Couple questions about this recording and the slide deck. Would they be available, and when will they be available for others to view?
Of course they would be available. Just a word of caution, as you've all witnessed tonight, there's a lot of explanation behind some of this short phrases. So as always, just reach out. If you have more questions, reach out to us. But we will we'll somehow link it, or you're gonna be receiving letters anyway very shortly.
You can post it to the same information doc that we have used and updated since the start of the school year. So you can watch once we get the video rendered and YouTubeified, we'll post it there along with the slide deck so you can read that yourselves.
Okay, and then a group of more complicated questions really focused on class configuration and teachers. So questions surface around, will my child stay in the same class with the same teacher? And will there need to be some reconfigurations as other students are leaving to go to Red Remote?
So the answer to that is possibly. We're still, again, after the deadline of noon today, we're looking at what those final numbers are looking like. And there is a real possibility, depending on what our model is going to have to be, that depending on who the teacher who teaches the Red Remote, those students would have to then either have a new teacher or be placed in existing teachers. Remember, the Red Remote would be affiliated with a school, so it may not necessarily be the school your child currently attends if the teacher teaching the Red Remote is not affiliated with that school. So that there is that possibility. When we notify those families who have opted for Red Remote, you will know who that teacher is, what school she is. Well, I guess we have kindergarten teachers too, he or she is affiliated with. And then the other students in that teacher's class who did not choose Red Remote would then either have a new teacher or other teachers within that school would absorb those students. So the good news is that this is still early in the school year, so we want to do this quickly so that we have some certainty as we move forward. And the reason we are going to move forward with the Red Remote creation of the new classroom would be, or moving students to the Red Remote would be, that we want certainty, and we are always optimistic we're going to be bringing students in eventually, and sooner than later, hopefully. And so we just want to move forward.
I'm looking at the time, and I want to make sure that we are ready to end at 6. I know there's a parent edge event that many people may also want to get to tonight, so we want to be real respectful of that. Carol, is there one more question we could squeeze in the next 90 seconds?
We have more families that are asking again about getting on a wait list for Red Remote, or how do they access Red Remote again?
Just they should send that request to the principal of the school, your child's principal, and we meet many, many times a week, and we share information, and I'm sure we will compile that list. So I would just say send an email off to your child's principal, and we will safeguard that information and compile it and make considerations as we move forward.
I do want to make sure that we're transparent, that every time we make one of these changes, it's a significant staffing puzzle to put together. So, please do let us know if that's an interest of yours, but I don't want to promise that we can make that happen. It's quite a puzzle. So I just want to be transparent with that.
The one piece I would just want to kind of put out there is, we know that you as parents have been tremendous partners in this educational journey to start your kindergartners exploration into school. We certainly are working tirelessly to make sure we're providing options, but certainly our focus right now is trying to get them back into school in a safe way. But that also comes with a lot of planning. And it comes with a lot of preparation. And I'd be remiss not to thank our teachers who have been working and transitioned this year and built a model for online learning to launch that school year for your kindergartners the very best way we can. And we're excited at the new possibility of bringing them back. It's also been the principals who are here tonight, Tony Kuhn, maintenance and operations, Patrick Rock, our nurses, custodians, everyone has really pitched in, and it's going to continue to take that. And certainly to our leader, Superintendent Koloski, who the emails come in, and they're from all ends of the spectrum. Those who think we should have gone to school back in September 2nd, and those who feel like maybe we shouldn't come till next September 2nd. It is definitely challenging times, but I assure you, having spent 12 years in this district, the students are the priority. And we've got to find ways to meet their needs. And we really do believe that getting kindergartners back in school, along with our first graders next and our students who need the most needs, is really what they need. And then we'll focus on 2nd through 5th grade and 6th through 12th. But just as you as parents, thanks for your partnership.
Thank you. We hope you have a great rest of your evening, and please watch for additional information to be coming in the next days and weeks. Have a good night.
Hi, everyone.